My name is Elsie, I'm 12 years old and I live in Grampont. I've lived in Grampont since I was 3 years old and I love that it's a nice, small community and everyone knows each other and it's really nice. And I love the pool. Yeah, I just love the pool. Soap is really good because it's a big outdoor space and you can go there whenever you like as long as it's open. And the rec is this big green space which you can do lots of sports in and do what you like on it. And I love the park because it's really nice and fun to play in.
Living in central Oxford has some benefits, which are we are quite well connected to everywhere. The downside, sometimes, which is a double-edged sword, we have a lot of visitors, and sometimes we can have so many tourists. It's hard to even walk into town because you are in large groups.
My name's Amy. We live in Grampont, which is a really brilliant, safe, feels very safe community. Everybody knows everybody. It's been really great to have the children grow up here. The redeveloped pub on the corner has lots of social events going on. There's cafes, they've just opened a brilliant new cafe down the road. So it's a real hub of the community and we're really proud to live here and I don't really want to move anywhere else.
What we've been able to do through this is put £1 million worth of grant funding into communities in the 10 priority parts of our county. So that's incredible. If you think about £100,000 per community.
The Director of Public Health annual report in 2020 identified that we had hidden inequalities across some of our communities in Oxfordshire. As a result of that, we developed some community insight profiles, so we really understood both what their strengths were and what their challenges were in maintaining good health and well-being.
My name is Erica Charters and I'm Professor of the History of Medicine at the University of Oxford. I was the lead of this project called Oxfordshire Health Humanities, which examines the long-term context of community health in the 10 priority wards of Oxfordshire. Now, what is community health? I think when many of us think about our health, we think about hospitals, we think about the NHS, we think about GPs. But health is also something that's social and cultural. So it depends on the foods that you eat, it depends on when you eat, who you eat those foods with, it depends on the kinds of jobs that you have, what's important to you. A lot of our research involved talking to the residents who live in these neighborhoods, asking them what's important to them, how do they stay healthy in order to understand how to better support their health in the long term.
Our humanities approach with an anthropological twist is that we go into the community groups, participate in their activities, volunteering for their gardening sessions, join the stone painting in the art sessions. It also helps us to understand how important the social relationships and cultural differences are impacting on people's health and well-being.
Community history is a really important part of what we've been doing in this project. History is in part about people's identities, both as individuals but also as collectives and communities.
The support we provide here is it's supported accommodation for people with entrenched homelessness, people dealing with complex trauma, complex needs. Our hostel, O'Hanlon House, which is where we are now, is right in the centre of Oxford. We're just round the corner from Christchurch, so we've got like the typical dreaming spires just round the corner, and then here we are with people every night. We've got 56 bedrooms, and people who've suffered complex trauma, people who are dealing with addiction, with mental health issues, with poor physical health issues, with substance use. So the support we provide is more than just accommodation. It's about giving people that one-to-one support that they need. It's not always something you think about, homelessness in Oxford. It's everyone thinks about the university, but actually our services are sadly very needed here.
Well, I think Oxford in general is really beautiful, and especially central Oxford. There's a lot of historical buildings, there's a lot of beautiful libraries. I mean, even the street is just like so beautiful and so vibrant, basically. Like a lot of people, a lot of cycle.
There's a great disparity in Oxford between the beautiful, wealthy bits and the not so beautiful bits.
Oxford Community Breakfast is an initiative that we started in July this year, 2025, after we got funding from Work Together. There's between 50 to 70 people that sleep rough in Oxford every night. And we had a passion to reach out to our rough sleeping and homeless community in Oxford. Healthy living is something that is very key, and having a good start of the day is something that is really good because it sets you up for the rest of the day. And so we felt a good breakfast for some of our guests will be something that can set them for a good start of their day. So we provide a good, healthy, full English breakfast for homeless people and rough sleeping people and some of our vulnerable families within central Oxford.
I'd say it's diverse, cosmopolitan and friendly. My name is May Ellerman and I am the Community Health Development Officer for Central Oxford. I work with St Teb's by the River, so Hinksey. I also work with St Thomas and Osney area.
I work with the Central Oxford Inside Profile community, namely the Hinksey Park, Osney and St Thomas ward, to help with promotion, connection and access to health and wellbeing activities and initiatives. What I enjoy most about working with these communities is their willingness to better and promote their community. They are keen to connect and are welcoming the opportunity to use their local assets and create new ones.
Oxford's beautiful, if I'm honest. It's one of these spaces where we talk about it in the way where it's like a bubble, I always say. It's not a true reflection of what I see of the rest of the UK. It's very different. But that being said, what I find is, as I said, it's full of beautiful people. And the second you actually take the time to speak to somebody, you realize it's a beautiful space.
My name is Nicole. I'm here from Transition Lighthouse. Transition Lighthouse, we are a newly CIC, Community Interest Company, and we're based here running a women's group in areas such as Blackblaze, Barton, and a newly formed one in the city centre.
We start this group to support women, to help women, because we came from war. And we help them because they coming from a really bad situation. And we look after them and we give them all the support what we can for all this lady and different country, not just from Iraq. We have lots of different culture. Our community, we help women because they crying too much, and we find a good way to support them to do art. We start from art and they give us beautiful picture to contact with the museum. And they like it, and we contact more and more. We bring lots of ladies in our group.
Yeah, my name is Mariam. I'm from Pakistan, and I lived Oxford a long time here, and I joined lots of communities here. I'm a chef also, and I'm working with charity work as well.
My name is Dilber. I come from Turkey. I'm mother of 4 children. I do voluntary work with a lot of different charity.
And people are very supported here in Oxford, and I really like the lakeside and greenery nature, and it's beautiful in Oxford.
We work with young men aged between 18 and 25 who've got problems with the criminal justice system, and we give them mentoring sessions for 6 months. We take them away on a weekend, which we call a rites of passage weekend, which takes them from childhood with a lack of responsibility into adulthood, where they face up the responsibilities. And we help them to value the communities that they haven't been serving as well as they might, to really put something back in and take them away from a life of crime. The mentees of today are the mentors of tomorrow. They are the people who really help the young men. And there's no better form of publicity than a young man who's come from a criminal-based background to say, yeah, I've got a first-class honours degree in Bath University, which is a young man we were with yesterday. He's got a first-class honour degree following a passion that he had all his life, but couldn't see how to get there. And we just listened to him and said, hey, you can do this. Gave him the motivation, gave him the confidence, and he's there.
I think the important thing about Well Together is that it's not just about funding. I mean, funding is essential, but actually that support to be able to help people shape their ideas and then take those ideas through to delivery, and also to link those people that are doing that essential stuff in communities into the wider system is really important, and it's crucial to making Well Together work. And the community capacity builders who are from those communities and rooted in those communities are just an essential part of building that trusting relationship to deliver that work.
And as to infrastructure organisations, it's fundamental to what we do. Volunteering and community action isn't always free, and there are lots of barriers that need to be helped get over it, and that is very much about capacity building.
Yes, so it is. It's a culture change for health services to start to work in this way.
We know that health is something that's about the way that we eat food, who we eat food with, whether we have daily exercise. So community health is a way of thinking about our daily routine activities. What is it that you do in order to stay healthy?